The second way to save these clipboards is when you use the patient file. Now here's the list of patients. In this instance, I do not have yet a patient. So normally when the patient comes in, you first create a patient or recall an existing patient, and then you start to work on the case. You start to take symptoms. So I click here on the sub button and I select create a new patient. If I'm in a hurry, I can go to the consultation and start to type the symptoms, and only afterwards I can give it a name. Or if I have time, I click here on administration, and there are only 2 fields mandatory. So let me give it a name, Jenny Goldstein, and that's enough. You can give it, of course, the correct birth date or fill out any of the other fields. Now if I want to start to type the consultation, I click on the top of consultation and I can start to type. I can say here, for example, head pain in the forehead and in the morning. If I press on the keyboard the top key, I open a new field. And I can say here, for example, menses painful. And if I press enter, I remain in the same field. So I can say here, for example, weeping before menses. If I press enter again, I remain in the same field, and I can say Amel 2 days after menses appear. If I press on the keyboard a tab, I have a new field. So I could say ward on ring finger right side. Now, so in this way you can divide your symptoms each in a separate field or some text within the same field as things belonging together. Now let me double click here on the tab so that I open the text editor fully. The advantage now is that I can click on one of the symptoms and give it an intensity. So for example here 4, and this one I can give a 2. Also, I can identify certain symptoms as belonging to certain categories. So in this field here I click on the arrow down, and if I start to type disease classification, so DC, I have here the disease classifications of Hahnemann. If I want to select here, for example, an acute situation, I click here on it, I double click on it, and a label is added to this sentence. In our example here, let me do another one also with the disease classification. Acute, I say DC, and double click for acute. Now the advantage is if you have a long list here of symptoms, with one click you can summarize which symptoms you have categorized to a certain disease classification. And you do that as follows. On one of these labels, so here on the total disease classification acute, I click on it and a separate window opens and it shows you only those symptoms with that disease classification label. And you can see those symptoms only in the current consultation or in all consultations of that patient. Okay. So that's very nice to get an overview of the different symptoms belonging to a certain category.